Unfortunately, there simply isn't a one-size-fits-all treatment protocol for patients infected with Lyme disease and/or co-infections. This is why it's critical for physicians treating Lyme disease to invest time with patients, thoroughly understand their medical history, and closely monitor symptoms and treatment response. With that in mind, there are currently 2 different treatment approaches for Lyme disease. The Infectious Diseases Society of America, IDSA, and the International Lyme and Associated Diseases Society, ILADS, have each published their own set of evidence-based treatment guidelines. IDSA guidelines recommend a short course of antibiotics, typically 14 to 30 days. IDSA argues that the Borrelia burgdorferi bacteria do not persist in a patient beyond this time frame, and that lingering symptoms are the result of an ongoing immune response and not an active infection. It also cites scientific evidence claiming treatment beyond 30 days are ineffective, unnecessary, and even dangerous. IDSA physicians will stop treatment after 38 days following these guidelines, even if the symptoms remain. Some doctors will stop treatment after 30 days, even if the symptoms remain. They advise an additional 30 days of treatment for patients with Lyme arthritis. On the contrary, ILADS offers its own scientific data to show that additional antibiotic treatment is required to eradicate the bacteria. ILADS recognizes that a month of treatment may be sufficient for patients in the acute stages, but in cases where the spirochete has disseminated and the disease has advanced, a 30-day treatment regimen is inadequate. ILADS guidelines recommend additional antibiotics until a patient's symptoms have been resolved. Treating Lyme disease in its advanced stage can be a complicated process based on the complexity of the organism itself, differences in each person's immune system, the length of time infected, and the possible presence of other co-infections transmitted by the same tick. There are several choices in treating Lyme disease, which include oral, intravenous, and intramuscular antibiotic options. Other options may include sequential antibiotic therapy, higher doses of antibiotics, taking antibiotics for a longer period of time, a combination of antibiotics, retreatment, as well as diagnosing and treating co-infections. Some specific antibiotics used in treating Lyme disease are doxycycline, minocycline, amoxicillin, cefuroxime, azithromycin, and clarithromycin. Other tests include measures of blood counts, chemistries, liver function tests, ANA, double-strand DNA, rheumatoid factor, TSH, free T3, free T4, and ESR. These tests may be helpful at ruling out other conditions. Referral to a specialist might help rule out other conditions. I find shared decision-making with my patients helpful. I also find follow-up helpful to assess my patient's response to treatment and to rule out other conditions. There are additional protocols that may help aid in treating Lyme disease, such as avoiding alcohol, simple and processed sugars, exercising as tolerated, counseling for a Jerick-Hersheimer reaction, managing symptoms, monitoring and reducing the risk of an adverse event, and reducing stress. However, there's a chance of side effects such as C. difficile. Probiotics have been prescribed with the hope of reducing the risk of C. difficile.